I really wanted to do this with you because we know we have the Medicare enrollment coming up soon. And with you being a Medicare expert, it's important that people understand why they need to sign up for Medicare, how early they need to sign up for Medicare, and all the pros and cons about Medicare. So we're going to dig in and talk about Medicare and why it's so important for folks to sign up when the time is right. So tell me, why is Medicare so famously stressful for families? And is it actually as complicated as it feels when the mail start rolling in?
Well, get too worried about how Medicare works. People should talk to someone who is licensed and certified who can explain how the system works. It's
Okay.
really very simple once you boil it down.
Okay. So you're a licensed professional.
Yes. Part C are the Medicare Advantage plans.
Okay.
When you first turn 65, you can sign up 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after.
Okay.
If you miss that enrollment period, you're out of luck until the next annual enrollment period,
And when is that?
October 15th through December 7th,
Okay.
as long as you've signed up for Part B. If you haven't signed up for Part B or Medicare, then you have to wait until the following January to sign up. So I encourage people to sign up as soon as they can, 3 months before you're turning 65. Get A and B, unless you're working and have comparable coverage, get A and B, and also get Part D. There are numerous plans available that cover prescriptions at zero cost.
I agree with you wholeheartedly. So is there any part of the alphabet soup we missed or I missed to mention?
But that is the parts, that's with the federal government. We haven't talked about plans. Plans are a whole different area.
So basic Medicare doesn't usually cover dental, vision, or hearing.
There's nothing.
How do people get coverage for things like eyeglasses, hearing aids without spending a fortune?
If people decide to go the supplement route, and by going the supplement route, they're taking a plan, let's say a plan G, that does not cover glasses, dental, vision, hearing, doesn't cover any of that. With an Advantage plan, it will pay some of that. Typical Advantage plan that I represent will cover a couple pairs of glasses a year, $1,000 towards hearing aids. Dental, it's a basic small amount of coverage to try to keep people healthy. You asked earlier about what the catch was.
Yes.
How can an insurance company, on one hand, charge $175 a month to begin and or charge zero per month? You don't get any. The old wives' tale is you don't get anything that's any good for free. What the insurance companies do, what the federal government does, is when someone signs up for an Advantage plan, the insurance company goes to the federal government and receives a check for an amount no less typically than $18,000 per person. If the person is sick, if the person has medical conditions, they receive more than $18,000 per person.
Okay.
That $18,000 is used by the insurance company to keep the person healthy, theoretically. So the insurance company wants you to have your teeth looked at. They want you to have your vision checked. They want you to have your hearing checked. They want to try to keep you healthy. They offer memberships in health clubs for free at no charge.
Yes.
This is all designed to try to keep people healthy so that they do not end up sick in the hospital.
Yeah. Makes a lot of sense. So is Medicare something you just pick once and you're done, or should we be reevaluating our plans every year? And I heard you say you can sign on I think it's January 1, I think you mentioned?
January 1 starts the open enrollment period. The open enrollment period runs through March 31st.
Mhm.
That allows someone to change from one Medicare Advantage plan to another. Let's say a client receives a plan that was working and now they discover they don't like it or they heard that a different plan offers more. During that time period, they can switch. So you're not stuck with just one plan every year. You should look at
Mhm.
what your plan has,
Mhm.
what's being offered elsewhere, and what prescriptions are covered.
Mm.
This year was especially important with prescriptions because there's so much happening with drugs.
So, what happens, and you just mentioned this, what happens if a patient's health changes or they get prescribed a very expensive medication mid-year? And you just mentioned they can't change their plan until the year is up. So they just have to bite the bullet and pay for the meds?
Depends. The med has to be covered in the plan. Insurance companies can pick which drugs they insure in their formulary, and insurance companies can set the different tiers. We've seen a lot of drugs move up and down in tiers this year based on what Washington has done. We've seen a lot of drugs being taken out of formularies and other insurance companies picking them up in their formularies. So if they get prescribed a drug and it's in the formulary, the most that a client will pay is $2,000 a year.
Okay.
It used to be the donut hole was 7,500. You
Mhm.
had to pay 7,500 out of pocket before it was covered at zero.
Wow, that's a lot.
Now that's a lot. Now that's 2,000. But the key
Okay.
is it has to be in the formulary.
Okay. If a person signs up for the Medicare Advantage plan, can he or she then return to regular supplemental plans?
What state are you in? It depends on your state.
Okay.
Now, the reason I say it that way is if you have a Medicare supplement and decide to take a Medicare Advantage plan during the first year, you can switch back to a supplement. All
Okay.
all you have to do is come to an agent or do it yourself and say, "I don't like the Advantage plan. They lied to me." And you can enroll back into a supplement. After the first year, depending on the state that you are in, then you can go back without underwriting. In the state of Illinois, Blue Cross and Blue Shield is a guaranteed issue Medicare provider. So if you take an Advantage plan and 4 years from now decide to go back and have a supplement, you can sign up for a Blue Cross and Blue Shield guaranteed issue, Plan G, Plan N, whatever. You will not be penalized. The rate will be higher based upon your age. There's no penalty for being out of the system for that long. Most insurance companies have to underwrite you. So if you decide to go back to a supplement, you can be underwritten by a different company. The problem with underwriting is it's extremely strict.
Okay.
They don't want somebody coming in at 75, been with an Advantage plan, and then coming in at 75 when they're starting to get sick.
Okay.
Unfortunately, it's all economics. It's all about the money.
Okay. Well, I'm glad that you're, talking about this piece because a lot of times people don't understand. Heck, they don't understand Medicare in general. And then the bits of components that's attached to it. That's why I can see why it's so confusing and people just choose out of choosing and not really understanding what benefits they have because it's so confusing.
The biggest the biggest mistake I see people make is that they will not take an Advantage plan because they're afraid of not being able to go back to a supplement plan. And quite frankly, in my experience, they've both paid the same. It's as long as you're with the right company.
Okay.
The key is being with the right company.
Most people pay into Medicare for 50 years but have no idea how it actually works. That's why we're talking to Daniel Olofsson of LifeSmart Senior Services. With 16 years of experience, Daniel and his team match your specific doctors and prescriptions to the best possible plans. Whether it's Medicare, the alphabet soup, or the supplements. His goal is to maximize the benefits you've earned at no cost. Stay ahead of the curve with our community resources. Join our free newsletter, get expert takeaways and action steps delivered straight to your inbox. Connect with me. We're moving our community to Facebook, so follow us on Facebook, Instagram, and TikTok for the announcements. All the links are in the show notes. Remember, I see you and you're not alone. Now let's get back to the interview. Okay. So why is it better for a family to talk to an independent consultant like you instead of just calling the insurance company directly?
If I call Blue Cross and Blue Shield, the odds of them telling me about a different insurance carrier or a different program are slim and none. If I am an agent who is locked into one company, the odds of me telling you about 20 different companies are slim and none. In order for me to do what I do, I have to be licensed by the state and certified by the federal government. Once a year, I take a test. Once a year, I have to pass the test with a 90% or better in order to be able to do what I do. If I work for a private company, if I work for one company, one healthcare provider, I don't have to take the test. I will be giving people, theoretically, I will be giving people advice without knowing what the other companies offer or what the other programs offer. And again, if I can only sell bananas, I'm not going to tell you how good an apple is.
My husband would say a shoe salesman is not going to not tell you you need a new pair of shoes.
Exactly.
Yeah. I get it. So good that we're doing this interview with you, Dan, because people need to understand what their options are, especially when it's time to sign up for Medicare, which is already a complicated matter. So if someone is feeling completely overwhelmed, like I am right now in this moment, being being an adult child, because that's the other thing we didn't talk about, Dan, is the adult child mostly will help mom or dad sign up for Medicare. So, and it's very overwhelming. So right now, what is the one thing that an adult child should do to get some peace of mind? I'm talking to the adult children.
Listen to a licensed certified insurance broker. Do not listen to my aunt, my uncle, my grandfather. Do not listen to what their under 65 insurance agent tells them. Because an under 65 insurance salesman, unless they're licensed and certified with Medicare, has no idea what Medicare provides. It is a completely different type of insurance. Insurance is insurance, but it's like comparing a Ferrari to a Volkswagen Beetle. They're both cars, but the Medicare is so specific and it's so different than under 65, you can't compare the two. So an adult child should take themselves out of what they've got, what they're experiencing, and what's going on with their insurance, either through work or private, and listen to someone who just wants to educate them. My goal is never to make a sale. I could care less if people sign up with me or not. My goal is to educate If they can be educated and know what's better for them, it's much better for me because then I've helped somebody learn about a very simple system.
Simple but complicated.
Yes.
So, is there
Once
anything that I didn't ask you that you think our aging audience or even the adult child who is might be overwhelmed with getting mom or dad signed up?
compare. Write
Okay.
notes, ask questions, write down questions. They should not call me or another agent and ask one question. They
Okay.
should write down their questions and then write down the answers. Because as you said, it's complicated. It's simple, but it's complex.
Yeah.
It's simple once you understand how it works, but it's complex.
Mhm.
And the first 1 or 2 times mom or dad or the client goes into the doctor or a
Mhm.
hospital, call the agent and have the agent walk you through what to do. And they should look at a hospital indemnity plan if they do the Advantage plan.
Okay.
A hospital indemnity plan for seniors is like Aflac on steroids.
Okay.
Good thing about a Advantage plan is most will typically cost 0 per month.
Okay.
The bad thing about an Advantage plan is there are copays. If you go to the hospital, there's a copay for the first 6 days. If you
Mhm.
go to a specialist, there's a copay. If you go for outpatient procedure, there's a copay. With a hospital indemnity plan, you're paying between $40 and $50 a month, but that covers you for any unexpected hospital stays.
Okay.
I tell people, and if you're working for a hospital, don't pay attention to what I'm about to say. I tell people, do not pay a hospital bill until you submit that bill, the statement, to your hospital indemnity plan, get the
Mm.
check from the hospital indemnity plan, and then pay the hospital.
I love it.
Because if you pay the hospital out of pocket, in my experience, the hospital will have 0 percentage of trying to help you get the money from the hospital indemnity. You're going to
Okay.
need a bill and a detailed statement for the hospital indemnity plan to pay. If the hospital is owed money, they will get that information to you. If the
Okay.
hospital is not owed money, it's a whole different ballgame.
Okay. So I heard you say ask questions, ask a lot of questions, get a pen and paper, ask questions. So tell us maybe 1 to 3 questions that either an adult child or a senior should ask about Medicare when they're trying to get signed on.
Are my doctors are my doctors or parents' doctors in this program?
Okay.
Do they have the freedom to see any doctor they want, or do they need a referral? How much are the out-of-pocket costs for copays?
Okay.
Is there any opportunity for giving us money back with our Social Security?
Okay.
Are the drugs covered? Are the drugs in the plan and in the formulary? That's really it. That's a good place to start. I saw you roll
Yeah,
your eyes
that
when I said
that
give
those
money back.
yeah, those are those are great questions. First of all, and then you mentioned something about Social Security, and I'm like, huh, I've never heard of that before. So let's dive into that for just a moment.
If you are a veteran and you want to get your prescriptions through the VA, if you are a veteran that qualifies, most veterans qualify, your prescriptions will cost you 0 to $10. I can get you money back to the Social Security deduction for Medicare Part B. That will vary between $80 and $145 per month.
Wow. That's a lot for somebody who's low income and or retired.
Yes, and if you are low income and qualify for Medicaid, I can get you there are programs available. Your It's called a D-SNP, Dual Eligible Medicare, Medicaid. There are programs available which will give you a spending card. Now, you've seen a lot of that on TV. The spending card can pay
Yeah.
for living expenses, utilities, gas for your car, healthy food. Those will vary between $80 and $240 a month.
Wow, that's a lot for somebody who's low income and is retired.
Yes,
That's a
yes.
lot. Okay.
So there's all types of give back programs. The client has to be careful
Okay.
that the doctors are covered.
Mm. That's a lot of good information. So what I'd like to do is ask you to come back and break down the alphabet soup for us, one letter at a time, because I
Lo-
know there's a lot to cover with each of those.
I would love to.
Awesome. Thank you, Dan Olofsson, for joining us today on the Give a Care podcast. And before we go, I'm going to ask you one last question. How do you give a care, Dan?
Give a care because I educate people. I want them to know what they're doing. It's unfathomable that we work for 50 plus years. We pay into the system and we have no concept of what's available. I want to educate people. I would like everyone to sign up with me, but I could care less. I hope that doesn't sound arrogant, but I want them to know what they're signing up for. I want them to know what they're going to do because an educated consumer can take care of themselves.
Yes, I agree.
Whereas,
You've helped me and you've helped a
whereas
lot of
somebody
other people.
whereas somebody that just walks into an insurance office and says, "I need Medicare," it's it's not good. When somebody says, "I'm all set," they're not set. They don't have a clue what they're doing.
Okay, Dan Olofsson, tell our audience how they can reach you.
I am right in New Lenox on Route 30. The best way to reach me is by phone. My phone is 708-699-9016. They can call or text 708-699-9016.
Thanks
It's
again,
been a
Dan
pleasure.
Olofsson. Thank you very much for joining me.
My pleasure.
That was Daniel Olofsson. And I think the message is clear. Your Medicare plan should be as unique as your medical history. One of the most important things to remember is that Daniel's expert advice and guidance is paid for by the insurance companies, not by you. So there's no reason to navigate this complex system alone. Your next step? This week, take 10 minutes to look at your current plan and your list of medications. If you aren't 100% certain you have the best coverage for your needs, call for a professional review to ensure you're protected.